Another day, another video of first aid by OTC Medicine. Heartburn, causes, symptoms and treatment. First aid by. Welcome to this guide on OTC medicine for heartburn. Heartburn can be an uncomfortable and bothersome condition, but luckily there are a number of over-the-counter, OTC, medications that can help reduce symptoms and provide relief. In this video, we'll be discussing the different types of OTC medicine for heartburn, as well as the benefits and drawbacks of each. We'll also be providing advice on when to see a doctor, and tips for prevention. So, if you're looking for help with heartburn, read on. Heartburn is a common condition that occurs when stomach acid backs up into the esophagus, causing a burning sensation in the chest or throat. Over-the-counter, OTC, medicines can be effective for treating heartburn. Here is some information about the causes, symptoms, and treatment options for heartburn. Causes. Eating large meals or taking over-the-counter medicine to treat heartburn can have a negative effect on your digestive health. Eating large meals can cause a feeling of fullness and bloating, which can lead to acid reflux and heartburn. Lying down right after a meal can also be a problem, as this can cause the stomach acids to back up into the esophagus. Eating smaller meals and avoiding lying down for at least an hour after a meal can help to prevent heartburn and acid reflux. If you are taking over-the-counter medicine for heartburn, it is important to follow the instructions on the label carefully, as taking too much can cause more harm than good. Being overweight or obese is one of the leading causes of heartburn. Eating unhealthy foods, not exercising, and consuming too much alcohol can all contribute to this condition. Additionally, certain medications, such as over-the-counter, OTC, medicines, can also increase the risk of heartburn. OTC medicines like antacids, H2 blockers, and proton pump inhibitors can all reduce the amount of stomach acid, which can lead to heartburn. Therefore, it's important to speak to a doctor before taking any OTC medicines to ensure they won't worsen the condition. Cause and effect often come into play when it comes to health and wellness. Eating a heavy meal and then exercising can cause heartburn, as the body is not able to properly digest the meal, and the extra strain on the digestive system can cause acid reflux. To counter this, many people turn to over-the-counter, OTC, medicine to reduce heartburn symptoms. OTC medicines such as antacids and H2 blockers can reduce the amount of acid produced by the stomach, reducing the symptoms of heartburn. However, these medicines should be taken with caution, as they can have unwanted side effects such as headaches and constipation. Smoking and the over-the-counter medicine used to treat heartburn are two of the most common causes of various health problems. Smoking is directly linked to an increased risk of heart and lung diseases, as well as cancer. Over-the-counter medicine for heartburn can cause side effects such as nausea, headaches, and abdominal pain. Both of these activities are known to increase the risk of developing a variety of serious medical conditions, including heart disease, stroke, and high blood pressure. It is important to be aware of the potential risks associated with both activities and to take steps to reduce them. Pregnancy can be an exciting yet stressful time, and it can be even more stressful when a pregnant woman is dealing with heartburn. Heartburn is often caused by the increase in hormones during pregnancy and can be aggravated by eating certain foods or drinks. Over-the-counter, OTC, medicines can be used to help alleviate some of the symptoms of heartburn, such as antacids or H2 blockers. However, it is important to consult a healthcare provider before taking any OTC medicines during pregnancy, as some of these medicines may not be safe for use in pregnant women. Consuming certain foods and drinks can be a major cause of heartburn. Alcohol, caffeine, spicy foods, and acidic foods are all known to cause heartburn. In addition, certain over-the-counter medications may also cause heartburn. All of these can lead to an increase in acid production in the stomach and cause the uncomfortable burning sensation associated with heartburn. It is important to understand the dietary triggers of heartburn and to avoid them whenever possible to prevent the occurrence of this condition. Symptoms. Burning sensation in the chest or throat is a common symptom of heartburn. Over-the-counter, OTC, medicine is a convenient and effective way to treat the symptoms of heartburn. Antacids, such as Tums, Prilosec, and Rolaids, neutralize the stomach acid that causes heartburn. Proton pump inhibitors, such as Prilosec, Prevacid, and Nexium, reduce the amount of acid produced in the stomach. Other OTC medicines, such as H2 blockers, work to block the histamine that signals the stomach to produce more acid. OTC medicines are available in liquid, tablet, and capsule form and can be taken once or multiple times a day. It is important to follow the directions on the package and talk to a doctor if the symptoms persist. Symptoms of heartburn can include a burning or sharp pain in the chest, a sour or bitter taste in the back of the throat, difficulty swallowing, regurgitation of stomach acid or food, and an uncomfortable feeling of fullness after meals. Over-the-counter, OTC, medications such as antacids and H2 blockers can help to relieve symptoms of heartburn. Antacids work by neutralizing stomach acid and H2 blockers help to reduce the amount of acid your stomach produces. If OTC treatments are not effective, your doctor might prescribe stronger medications to reduce acid production and help heal the esophagus. Having difficulty swallowing can be an indication of a more serious health issue, such as acid reflux or GERD. If you are experiencing difficulty swallowing, it is important to seek medical attention. Over-the-counter medications such as antacids and heartburn medicines may provide temporary relief, but it is important to consult with a doctor to determine the underlying cause and proper treatment plan. Coughing or wheezing can be symptoms of many different ailments, including allergies, asthma, or a common cold. If you are experiencing these symptoms, it is important to talk to your doctor to get an accurate diagnosis and treatment. For relief of symptoms, over-the-counter medicine for heartburn may provide temporary relief. Talk to your doctor before taking any medicine with your symptoms, as it may not be the right treatment for you. Nausea and vomiting can be uncomfortable and embarrassing, but they are also common symptoms of a range of ailments. Heartburn, in particular, is a common complaint that can be treated with over-the-counter medications. Antacids, like Tums, Rolaids, and Maalox, are among the most popular medications for heartburn, and they work by neutralizing stomach acid and providing relief. Other medications, such as Zantac and Prilosec, work by reducing the amount of acid produced in the stomach. While these medications can provide temporary relief, it is important to speak with a doctor if the symptoms persist or worsen. Treatment. There are several OTC medicines that can be effective in treating heartburn. These include antacids. These work by neutralizing stomach acid and can provide quick relief. Examples include Tums, Rolaids, and Maalox. H2 blockers. These reduce the amount of acid produced by the stomach and can provide longer-lasting relief. Examples include Pepcid AC and Zantac. Proton pump inhibitors, PPIs. These are the strongest type of OTC heartburn medicine and work by reducing the amount of acid produced by the stomach. Examples include Prilosec OTC and Nexium. In addition to taking OTC medicine, there are also lifestyle changes that can help reduce heartburn symptoms. These include eating smaller, more frequent meals, avoiding foods and drinks that trigger heartburn, losing weight if overweight or obese, quitting smoking, elevating the head of the bed when sleeping. If heartburn symptoms persist or are severe, it is important to see a healthcare provider for further evaluation and treatment. Thanks for watching.